A very good morning to Doctor and my fellow batchmate. Today, Group 2.1 will be presenting on importance of soft skills in patient communication. And before I start, let me introduce myself. My name is Abhinaya, and we have divided ourselves to present. So I'll start off this. So what is soft skills? It is an interpersonal skills which means the quality that consists of combination of personality and personality traits, behaviors, and social attitudes. It allows people to communicate effectively and it also collaborate and manage conflicts. Let us look at what is hard skills versus soft skills. So, looking at hard skills is professional skills acquired through education and training program, whereas soft skills is totally personality. In hard skills, it is easy to quantify and it is also measurable. Whereas in soft skills, you can't measure or evaluate. It's very difficult to measure and evaluate. Looking at the hard skills, it's a logic center of the brain, whereas the soft skills is an emotional center of the brain. Hard skills is more of IQ, which is intelligent quotient. Soft skills is EQ, which is emotional intelligence quotient. Hard skills is also proficiency in foreign language, degree or certificate, and technical skills. Soft skills is more of communication, leadership, and teamwork. So that is all from me. Let me pass my presentation to my friend. Thank you.
Good morning to doctors and my fellow friends. My name is Caris. Now I would like to continue with soft skills in dental practice. First, the dentist should have a strong work ethic. They should be hardworking and responsible. For example, they are highly motivated and dedicated to do their best work. They should be punctual to attend every appointment so that the patients will feel they are respected. They should have a good time management skills by using time on their jobs wisely. For example, they should be able to work confidently on different projects and prior the tasks accordingly. Next, dentists should have a good communication skills. They should be able to communicate with their colleagues, assistants, and patients. Dentists will have to talk to their patients about oral care routines and explain to them what you are going to do during the treatments. Dentists should also be a good listener by showing interest in the conversation with patients. Let them talk to make them feel they are welcome. Dentists should always be caring about patients' concern and take time to listen about their fears and give motivations to them. Furthermore, dentists should have problem-solving skills. They should be able to handle patients' complaints and answer their questions without impatience. They should also take the initiative and creatively formulate solutions to solve problems. For example, if you have very scared patients, you will need to figure out how to complete the treatments. Also, flexibility and adaptability, which means that dentists are able to maintain a good attitude even though some issues divert from the plan. They should be strong enough to adapt to new situations and challenges even though in any new workplace. They should also be willing to accept new things. That's all from me. Thank you.
Good morning, everyone. I'm Chang Yuan. For most of the day, dentist is working around people. Hence, communication skill is an essential ability for us to learn. To develop communication skills, we should first practicing interpersonal skills. Be friendly and encouraging when communicate with patients by using appropriate tone. so more or less their anxiety can be eased off. Next, show empathy to our patient even though if he is in a middle aged. The fear to dentists is the same. Understand how the patients feel and identify their needs. Also, interact with the patients and show interest in their conversation. It is recommended that we always begin an appointment with a casual chat. The most important one is to involve the patients in their own treatments. First, tell the patients that the problems precisely using simple terms like ulcer rather than using aphthous stomatitis, and explain to the patients how the problems occurred, and also list out the treatment recommendations and inform them the pros and cons of each treatment. Let them to decide on their own. Explain the procedure of the treatment so that they know what are we doing in their oral cavity and feel secured. Last but not least, get permission from the patients before proceeding with the treatment. Probably we can ask the patient to sign on the treatment plan for what they have chosen. That's all from me, thank you.
Good morning to Dr. Jega and Dr. Praveen. I am Abigail. I'm going to talk about few parts of the importance of soft skills in dentists. There are 8 soft skills which are required in order to communicate with the patients effectively so that the patients can gain comfort and satisfactions from the treatment we give them. The 8 soft skills are listening skills, compassion, professional appearance, attention to detail, positive attitude, dexterity, problem solving, and oral communication. In interpersonal skills, dentists should be able to effectively communicate with their patients. Good interpersonal skills, which include the following, such as active listening, empathy, diplomacy, adaptability, leadership, and patience. Active listening is a communication technique which involves the full and active application of the listener to what is being said. Active listening cues include eye contact, nodding of the head, smiling, and verbal affirmations. Active listening encourages the people you interact with to communicate and to provide you with a forum or a communication in return. For body language, a dentist's body posture and facial expressions play a huge role in how the patients interpret what he or she say. However, there are several body language which communicates disinterest the patients, such as avoiding their eye contact, folded arms or legs, glancing at clock, watch, or phone, and yawning. Nonverbal communications, which bring the advantage, are relaxed open posture, engaged eye contact, nodding head, and smiling while talking to the patients. That's all from me. The other soft skills will be explained by my other group mates. Thank you.
Now I'll explain why interpersonal skills are important to a dentist. As mentioned just now, interpersonal skills are being able to communicate effectively. If you include your patients as fully informed partners in their care, they return the gesture by being loyal and continuing care with you. You'll discover more satisfaction in your work, and it will help to renew motivation and also increase productivity. When patients have a positive experience during the treatment, they will be more inclined to accept a recommended treatment. Open dialogue with patients results in better understanding and also reduce in complaining about the service and treatment. Interpersonal skills also provide a base to develop a better dentist-patient relationship. The first key to develop interpersonal skills is smiling. An individual who smiles while communicating with others will be inspired as confident, honest, and trustful. A genuine smile is one of the most influential, powerful, and persuasive parts of all body language. There's a saying, smile is contagious and it doesn't cost anything. So, we should smile often. Next key is talking to people. By talking to people, we can gain more experience in communication skills and also can learn to communicate with various types of people. It will help to develop listening and understanding skills. The third key will be practicing compassion. Empathy was positively connected with negotiated treatment plans, treatment adherence, increased patient satisfaction, and also reduced dental treatment. By being empathic, the dentist can understand what patient feels and experience, which is a need in dentist-patient relationship. So, put yourself in their shoes and don't just tell a patient something, but explain to them why it's important and don't forget to show your compassion.
Hi, I'm Cheng and I'm going to talk about problem solving. So a dentist need to make a lot of critical decisions. With diagnosis and treatment plan, there may be many options to solve the problem for your patients. But the problem is not only arise from the patients. It can also arise from the management of your team or your business or any other billing or marketing issues. So why is problem solving so important for dentists? It allows dentists to analyze and decide a treatment plan and also allow the dentist to run the clinics, and the dentist will be able to solve the patient's problem and also show the dentist leadership skills. And also it is important for dentists to take the responsibility and initiative to solve the problem. Like for example, if you have a patient and he or she is very scared and anxious, you need to think of a way to calm them down. You can either, give distraction or also some conscious sedation to ease their anxious. So how to develop problem-solving skills? First, you need to identify the underlying problem by focusing on the root cause and also question yourself to find the root cause. So then you need to list out the solutions. Do not rush into the first solution that pops up in your head. You need to find alternative solutions, and then when you have option, you might be able to see like which solutions have the least amount of repercussions and then decide from the list of the solutions. Next, you need to come up with a plan. You can discuss with your colleagues and get all their opinions. So then you can choose the option that implement with greatest gain with the lowest risk. Also, planning will help to build team trust and also leadership. Finally, implement and evaluation. When during the implementation process, assess the responsibility and outcome will be expected. Thank you.
Good morning, everyone. My name is Chu Yishen, ID number D180900732. Today, I will going to talk about the positive attitude of a dentist. As a dentist, we should show a positive attitude in a professional way. So there are some characteristics which mainly associated with a positive attitude, which include optimism, acceptance, resilience, gratitude, mindfulness, and also integrity. So why is it positive attitude so important for dentists? Positive attitudes can make dentists to feel better at their own dental office and improve the way that people view us as a person, and also increase the consistency of high performance of dentists and his or her team. From the patient aspect, patients will feel better, encouraged, and also satisfied with any dental treatment when surrounded by positive dental officers. In a teamwork, positive attitudes can keep everyone trying new things, brave about brainstorming the new ideas, and makes dental officers excited to go to work with their co-workers. So there are some examples which dentists can show positive attitudes, which is speaking politely with their own patients or colleagues, and try to use positive words when expose bad news or explain some information to their patients in the way that it can change patients' negative thoughts to in a positive way. So a sympathetic attitude of dentists helps in patient care because it helps in trust building relations. Next, how should a dentist develop positive attitudes? First of all, we can use a positive language to communicate with our own patients or colleagues, and never criticize anyone, include your patients and also colleagues, and then stay away from gossip which will cause conflict, and put teamwork first and try not to complain. That's all from me. Thank you.
Morning to Dr. Praveen and Dr. Jega. I'm Ang here, would like to present the following subtopic, which is the importance of soft skill in patient's perspective. First of all, as a dental practitioner, we have to understand the behavior of the majority patients towards a dental treatment. A dental appointment is usually a bad experience for patients, and they will rather to avoid the treatment every time. This is because, based on studies, about 75% of the patients experience a degree of anxiety before the actual treatment happens. And about 5% to 10% of the patients are very worried about the treatment and they will avoid it. Such anxiety from patients can be reduced by establishing a good soft skills and social skills by dentists, as what my group mates mentioned earlier. After understanding a patient's behavior, let's look at what will a patient expect us as a dentist during a dental treatment. According to a patient, a good dentist is the one who can recognize the patient's anxiety and will manage it properly. Secondly, patients expect a dentist to establish and maintain the support and be supportive to the patients during the treatment. And for third one, patients will reduce their fear and anxiety by building more trust on you when we provide information and explanation about the various procedure and what are going to happen and what had happened, possible outcomes, and its complications. Whereas for a bad dentist, majority of patients will often complain about the lack of social skills and soft skills rather than the professional skill of a dentist. To make a patient feels comfortable with your dental treatment, you are not only to require a good professional skill, you have to master your social and soft skill too. And for those who are uncomfortable with the treatment and appointment, they are more likely to be late for the appointment or arrive later than the appointment time. That's all from me, and for the following subtopic, we will pass it to my groupmate Alice.
A very good morning to all of you today. My name is Chong Chi Wei, and now I'm going to talk about importance of soft skills in patients. Most patients is concerned with symptoms which are interpreted by themselves during dental treatment. Soft skills is important because it ascribes the presence of illness of patients according to the way they think or may be influenced by childhood or their own beliefs. Soft skills is also important because it is due to diet, changes in environment, or stress encountered by patients. Therefore, it depends on patients' own way to treat themselves before consulting a dentist or a doctor. Next, I'm going to talk about perception of patient. Of course, most patients trust their dentist so well and they expect dentists to have high technical ability, quality, and competency during dental treatment. Therefore, cost of treatment has to be reasonable or affordable for most patients. Convenience and availability to access treatment is also important for patients. Personality, behavior, and appearance of a dentist is important as it will lead to a good impression to patients during dental treatment. Lastly, is to understand friendliness, communicativeness, and supportiveness of a dentist is highly expected from patients. That's all from me. Thank you.
Good morning, doctor and my fellow friends. I'm Chong Shui. I'll be continuing with patients' needs. From psychological point of view, a dentist who masters in soft skills can fulfill a patient's needs and provide them with a pleased and less stressful dental experience. This can increase overall patient satisfaction. Dentists should also instill positive attitude and beliefs about the importance of teeth in their patients. It is more likely that effective verbal communication, power words, benefit statements, and outstanding customer service will motivate patients to accept treatment, listen to a dentist's instruction, and take care of their oral health. Satisfied patients enjoy their dental practices, trust dentists and their dental teams more. Coming to the anxiety and fear of pain. Generally, fear can be divided into two types: subjective fear and objective fear. Subjective fear is also known as acquired fear. It is the fear based on feelings, attitudes, and concerns that have developed in the patient after listening to the suggestions from their peers, siblings, and other adults. Objective fear is also known as learned fear. It is related to the patient's own experience and their recall of those experiences. After looking at these, I would like to say that it is important for dentists to identify the causes of anxiety and fear in their patients in order to help them to solve their dental problems, as well as providing them an enjoyable dental experience. To conclude our presentation for today, we, as dental professionals, should acquire both hard skills and soft skills. With good communication skills, we can provide good quality and satisfying treatment to our patients. As what we have discussed earlier, an effective communication benefits both the patients and dentists. Hence, every dental professional should possess excellent soft skills. That's all from our group. Thank you. Have a nice day.